Ever wonder just how common needle stick injuries and exposure to sharps, blood and body fluids are in the medical field? Needle stick injuries are incidents where a needle or other sharp object, contaminated with blood or bodily fluids, accidentally pierces the skin. These injuries are a frequent occupational hazard in the medical field. Such incidents can occur during various procedures like drawing blood, disposing of used needles, or even during surgery. The risks associated with needle stick injuries are significant. They can lead to serious infections, including hepatitis B, hepatitis C, and HIV. Unfortunately, these injuries are not rare. Every year, hundreds of thousands of healthcare workers worldwide experience needle stick injuries. This prevalence underscores the critical importance of understanding needle stick injuries and how they occur. Awareness is a powerful tool. Armed with this knowledge, we can take steps towards prevention, reducing the risk of exposure and protecting our healthcare workers. Knowing what needle stick injuries are and their potential impact is the first step in preventing them. But how exactly does one get exposed to these risks? Let's break this down. The process of exposure to needle stick injuries and blood and body fluids typically happens in a few steps. Firstly, medical staff may come into contact with these hazards during routine procedures, such as administering injections, drawing blood, or even disposing of used needles and sharps. Secondly, it's important to note that an injury can occur during or after use, or even when medical equipment is improperly disposed of. This is often due to haste, fatigue, or inadequate training. Moreover, exposure to blood and body fluids can occur through direct contact, such as accidental splashes during procedures, or indirect contact like touching contaminated surfaces or equipment. Remember, the process of exposure is not always obvious or immediate. It can be a subtle, silent risk lurking in the background of everyday tasks. Understanding the process of exposure is crucial in identifying the areas where prevention measures can be implemented. So what can be done to prevent needle stick injuries and exposure to sharps, blood and body fluids? Well, it's vital to remember that prevention is always better than cure, and in this case, it literally means following safety protocols religiously. Firstly, always use safety devices. This includes needleless systems and sharps with engineered injury protections. These devices are designed to protect you from accidental injuries, so make the most of them. Secondly, never underestimate the importance of proper disposal of sharps. Disposing of sharps carelessly can lead to accidents, so always dispose of them in designated sharps disposal containers. Lastly, follow safe practices. This means never recapping needles, always wearing personal protective equipment, and practicing good hand hygiene. Remember, it's not just about protecting yourself, but also your colleagues and patients. With these prevention strategies, medical staff can significantly reduce their risk of needle stick injuries and exposure to sharps, blood and body fluids. To recap, we've covered quite a bit today. We've delved into the nature of needle stick injuries, unraveling the intricate process of exposure to harmful blood and body fluids. We've also explored various proven prevention strategies. This knowledge is crucial, not just to medical staff, but to anyone who might come into contact with these hazards. The key is awareness, vigilance, and adherence to safety protocols. Remember, safety is everyone's responsibility. Stay safe, stay informed.